Hey, Eric Beiler for TYT Politics. I'm here with Dr. Margaret Flowers. She's someone I've known for a long time. First time I've interviewed her about this particular subject, which is really the most important issue to you as a pediatrician.
Definitely.
You just spoke about something very interesting that I didn't know. Well, I sort of had a sense, but I bet you a lot of our audience didn't know that the drive toward universal health care is intertwined with our segregated hospitals from the Jim Crow era. Can you basically rephrase what you said in the speech?
Sure. Yeah, no, thank you, because especially with Medicare's birthday coming up, the 52nd anniversary is next Sunday. Our hospitals were deeply segregated prior to Medicare, and there were a lot of efforts of doctors and patients trying to sue the hospitals to change that, but there was no mechanism for them to really do that. And literally, black people would come into, maybe have an accident or get sick and come into a hospital, and they would only have a very limited number of black beds down in the basement. And if those were full, they wouldn't even treat them or stabilize them. They would just send them out the door. And so, I don't even know how many people died because they didn't get the care that they needed in
You know who
time.
Bob Zellner is?
Bob Zellner, that same name sounds
Bob
familiar.
Zellner was a civil rights fighter, a white guy,
Uh-huh.
and one of his brothers in arms, a black guy named Silas McGee, was shot as he was resting in a car by a Klan member in the neck and then in the jaw. And so they were both members of the Student Nonviolent Coordinating Committee. Okay, so Bob brings him to a hospital, an all-white hospital. The guy's bleeding to death.
Right.
Bob's got his shirt wrapped around his neck, trying to stop him from bleeding out. And they say, you can't have a black man in this hospital. There's another hospital 30 miles away. And he said, I refuse to leave. You are a doctor. You've sworn an oath. You have to treat him. They called the cops on him, and the cops said, I'm going to arrest you. He goes, arrest me for what?
Right.
He says, indecent exposure. You're not wearing a shirt. So he gets the guy, Silas McGee, gets the guy in the car, takes him to the black hospital, and he lived. And he's still alive today. You can read about him in the Boston Globe.
So Medicare, when Medicare was passed in 1965, they suddenly had an enforcement mechanism because hospitals couldn't get their public dollars unless they desegregated. But that wasn't going to happen automatically. Civil rights activists made sure that they were present in each of the different hospitals, keeping their eyes open to make sure that they did desegregate. And so they desegregated 6,000 hospitals in 6 months after the passage of Medicare.
Because they wanted the money.
Because the hospitals wouldn't be allowed, they wouldn't get the Medicare and Medicaid dollars if they didn't desegregate. And so the idea of building a white hospital and a black hospital, because you were allowed to have separate but equal, but it's twice as expensive to build two hospitals, so they desegregated the hospitals, and that was a huge impetus towards that. But what's interesting as well during that is that Medicare was initially intended to be a pathway towards a universal health care system, Medicare for all. But Wilbur Mills, who was a Southern Dixiecrat, put a poison pill in there. He separated it out so that we had Medicaid for poor, Medicare for the seniors, and then Medicare was divided into two parts. So it was a three-layer cake is what they called it. Much harder to expand that into a universal system. So that was an obstacle. And what we're saying today is that this fight's been going on now for 52 years. It's time for us to do what we needed to do back then and skip right past, stop the Republican plan, but go straight to fighting for national improved Medicare for all.
I want to share with you an interesting exchange I had with a member of the alt-right. His name is Nathan D'Amigo. You probably know him. He's famous for punching a woman during a rally in Berkeley, California. But what he said to me is that he's actually for socialism. He's for socialized Medicare as long as you can exclude people of color. So he wants to make America white again, or white privilege only again, and then socialism would just be fine. And so my question is, there are many Americans who have sort of a watered-down version of that in their head, and they're concerned that if we have Medicare for all, that those people who already have privileges, including people of color who've worked their way up or whatever, they already have access to better health care than other people. And if there's an even playing field, that everyone has equal access, that somehow that privilege that they currently have for themselves and their families will go away. How do you respond to that concern?
Well, so I think it's important to understand that in the United States, we don't have a very good healthcare system, that because it's so much based on profit as the motive and not health, that the pharmaceutical research, the new drugs that are coming out are not necessarily better than what we have, or the new medical devices that we have they're not created because they want to improve health. They're created because people think they can make a profit off of them, and sometimes they harm our health. So our whole drive is about profit and trying to give more and more and more care, which isn't always the right answer. So under a national improved Medicare for all, and our outcomes show it. I mean, people should know that in the United States we rank very poorly compared to other countries that spend much less than we do on health outcomes and even longevity. Our life expectancy is declining now in this country, and in other countries it's rising. So we're not doing something right, and it really is this profit motive that, if you think about it, John Oliver did a really great segment on kidney dialysis, how the for-profit kidney dialysis centers really make money by churning people through, so they don't clean the equipment properly between patients, they don't give them a full treatment. It's kind of like, okay, you got enough now, somebody else's turn. So that's what profit does, and that if we had a national improved Medicare for all, it would actually change that whole dynamic so that we have a system that's based on health. That's going to be better for everyone. And so even people that have a lot of money are not necessarily getting good quality of care. I think anybody who's had experience in the hospital will know that you really have to keep an eye on what's going on there to protect your health when you go into the hospital these days.
You know, here's what I don't understand. When people go on and they say, well, single payer is going to cost $32 trillion over the next 10 years, and it's debatable whether that's true or not, here's what they omit. The current system costs $49 trillion.
Well, so he said $32 trillion over 10 years. I mean, we're currently spending, the numbers I've seen is around $3.6 to $4 trillion a year on healthcare, so that would be, $40 trillion over 10 years. I'm not sure exactly where his numbers came from, but basically the idea is that right now we're wasting a third of our healthcare dollar on paperwork and bureaucracy that do nothing for our health. In fact,
profiteering.
And profiteering, yeah. I mean, what the Affordable Care Act has done, it's been a huge shift of public dollars into the private industry, so that private health insurance companies' stocks are outperforming other industries, so that pharmaceutical companies are outperforming 4 or 5 times what other industries do, so that our private hospitals are pulling in a lot of money and actually cutting back on charity care at the same time. Everybody's milking the cow right now, right? And
isn't that what Richard Nixon said would happen?
Exactly. Yeah. And so
and he liked the idea.
Exactly.
Why is it? Because he could get donors?
Yeah. And there's some excellent, when he talked about the Health Maintenance Organization Act of 1973, which was when we actually privatized our healthcare system. It was Nixon who changed it from a public service to an entity that would be a for-profit entity. So, so if you take all of that out, if you simplify it down to a single publicly funded healthcare system, you're pulling at least $500 billion of administrative savings out of the system a year. Then there's an estimate another $100 billion in being able to negotiate for pharmaceutical prices. That's enough money to offset taking away all out-of-pocket costs like copays and deductibles and providing comprehensive coverage for every person and actually controlling healthcare costs. So the system that we have now is completely unsustainable, the track that we're on, and really National Improved Medicare for All is the only way to get things under control.
We have a question from the audience. Stacy?
We do. So Victoria Anji is asking, sorry if I'm pronouncing your name wrong. She says, I love the idea of single payer, but I'm confused about Medicare for all. I'm on Medicare, but it doesn't pay for everything, so I still have to have medical insurance. When they talk about Medicare for all, what happens to the part that doesn't pay for? In other words, will everyone have access to supplemental insurance?
So that's a really excellent question, and there is a piece of legislation called HR 676, or the Expanded and Improved Medicare for All Act, that I encourage people to read. It's a really simple piece of legislation to read. But basically what we're talking about is national system so that every person is in it, every health professional is in it. It's improved in that it's comprehensive. It covers all medically necessary care, so you don't need a supplemental. It also includes rehabilitative and long-term care, as well as pharmaceuticals and medical devices. And it doesn't have any copays or deductibles. And then it's paid for upfront through taxes like Medicare, but then when you need to go see a health professional, you just go do that. You don't have to just, everybody's in the network, you just call where you want to go and try to get an appointment. So it's National Improved Medicare for All, and it's comprehensive, universal, lifelong, paid for up front.
And so that's what
replace
our Revolution and Roe and that's what they're all for?
Well, yeah, so I think, Medicare for all is what everybody's saying, and one of the points that I made is that it's really important to be clear about what kind of system we want, because we know that these medical industries are constantly trying to push our members of Congress to, maybe do things that benefit them a little more than us. So HR 676 is considered to be the gold standard by the single-payer movement. It was written by health advocates and health professionals back in 2003, and it's everything that I said, that every person is in it, Every health professional is in it. There's no upfront cost. It's completely comprehensive, and it's paid upfront through taxes.
I was just listening to an NPR story about healthcare in Great Britain compared to here, and they had two people who had multiple sclerosis. Have you heard that story?
No.
So they compared the support that they each got from their health systems, and the person in Great Britain did much better. But there's this notion, it didn't prove out in this story, but there's this notion that you would have to wait longer in a system like they have in Great Britain, or I believe most of the other countries that have the kind of wealth that we do. You'd have to wait longer for a doctor because there is that government bureaucracy. I mean, how true is that?
Actually, it's a much simpler system than what we have right now. There's one set of rules. It's very transparent. You don't have to figure out who takes what and what do you pay first and what do they cover, and it's much simpler. Right now, doctors in the United States spend 2 hours on paperwork for every hour of patient care, which is ridiculous, and it's why our doctors are burning out and why the suicide rate amongst physicians is higher than it is amongst the general population. We're losing our primary care doctors in like 10 to 15 years of practice. That's not sustainable. We do have rationing in the United States, but we ration based on ability to pay. So to me, that's like the cruelest form of rationing. And if you want to talk about wait times, we have tens of millions of people who have no insurance. They can't even get into a line. We have tens of millions of people who are underinsured that because of co-pays and deductibles, they can't afford to get the care that they need. That changes in a single-payer system. People can get the care. What you see is a change in utilization. And we see this in other countries where people who are using the system too much will be using it less, and people who don't get to use it at all right now will get to use the system. So, it's a much more, fair and equitable system when everybody's in it. It's also an important point, and this bears out in other countries, is that when you have a universal system, nobody can buy out of it, everybody is in it, that it raises the quality of that system because people who are on the upper income spectrum are not going to tolerate a crappy system. Our members of Congress are not going to tolerate a crappy system because they're in it too. So welfare systems are poor because poor people are in them, but universal systems with that social solidarity are higher quality systems.
So I want to talk about what appears to be the failure of the Republican effort to repeal and or replace Obamacare, but quickly a related story. So I covered for a long time in North Carolina, out in the deepest part of the country, right near the coast, there was this hospital. It was actually the first Hillburton hospital that was ever built. It was the Belhaven Hospital, and it served a largely African-American community because of the civil rights legislation that you mentioned, at least in the town of Belhaven. But as you got further out into Hyde County, which is a neighboring county to Beaufort County where Belhaven is, it was mostly white people, Trump voters, and it was the only hospital they had. It was already 70 miles to get there, but a hospital for-profit, actually they have nonprofit status, but they act like they're for-profit. They came in, they bought the hospital, and they closed it down to eliminate the only competition they had in the region. And the way they looked at those Trump voters was, I only want to cherry pick the ones with good insurance. So if you're old enough to have Medicare, I want you. If you're not old enough or you're not rich enough to have good insurance, I don't want you. And they used that 100-mile drive as a sieve to prevent the poor Trump voters, the poor Trump voters in Hyde County, many African Americans too, but they prevented these people who think Trump is their savior from making it to a hospital at all, whether it's for emergency care because you're going to die on the way, or preventative care. So how would universal health care solve that?
So what we're seeing right now across the United States is just that same picture of if hospitals are not profitable enough, they get shut down. But under this, every hospital gets a global operating budget. They don't have to worry about profits. They're given the money to care for that population. And because we would have a system that actually where we determine where the resources are put, instead of having 3 hospitals within a couple of blocks in a city, we're going to use, space those hospitals out so that each population can get access to them. So it allows you to do health planning that we can't really do right now.
One more thing about this North Carolina story. If there are any Trump supporters or Trump voters or rural dwellers out there watching this, so what happened in Belhaven is this company called Vidant. They said, I'm going to harvest the people who have insurance, and then if I close down the only competition, right, then I can use these little urgent care or emergent care centers that I pop up basically to suck in the people with the good insurance. But the people who came into those centers who don't have insurance, they can be turned away now because it's not an emergency room anymore. That's why it was so important to close the hospital, that they did incredibly. They spent all kinds of legal fees. They even were able to get the African-American judge taken off the case so that they could get a white conservative judge. And now they've demolished the building to make sure that they have no competition for the cherry picking of people with good insurance. And one last thing, North Carolina is one of the states that refused to accept Medicaid dollars. So all of this could have been avoided.
That exactly what you said is why profit doesn't belong in healthcare. And we have many conservatives who have come out now and said that some of the most capitalist countries around the world recognize that when it comes to healthcare, it doesn't belong in the market because the incentive is to only treat people who have money, and the incentive is to charge as much as you can charge and cover the healthy people because you don't have to pay much for their healthcare. So it's a very perverse incentive that just really has resulted in low quality care in the United States.
Okay, last question. So the rally is starting to heat up. More people are showing up. It wasn't as well attended when you spoke as I expected it to be, with our revolution behind it. Do you think that the fact that the Republican little balsa wood plane is crashed into a mountain and burned, or is it in the process of burning, has decreased your turnout, or do you actually see that crash as a point that you can build upon?
I think we're definitely seeing it as something we can build upon. I mean, I've been in DC for a long time. It's very hard to get large turnouts, and
especially in 100-degree weather.
Exactly. And what we are seeing is that there are rallies going on all across the country, and there were hundreds of people out last night in Kansas City, Missouri, marching, and so it's much easier to get those crowds out locally. But what we're seeing, what's exciting to me, is that this effort has been stop the Republican plan, and then the Democrats have been trying to say, well, stop the Republican and we'll fix the ACA, and the people are just going, no, stop the Republican plan and we want national improved Medicare for all. So the enthusiasm, the excitement, the support for it is there. We know that we're already spending enough in this money in this country to cover everyone, so why are we going to mess with the ACA when we know it's never going to be universal? No, the time is right now for national improved Medicare for all, and that's what we're fighting for, and we're going to try to build off of this moment, and I hope that people will check out healthoverprofit.org and get involved.